Before we start, the important safety tip about Medicare Advantage. Gotta define some terms. People get Medicare and Medicaid confused. So here's a way to remember it. We give aid to those in need, Medicaid. You may never be on Medicaid. I have some limited help if you're on Medicaid, but only if you're also on Medicare. We care about our parents, Medicare. If you reach age 65, it is likely you will go on Medicare. If so, you'll get a red, white, and blue card. I can help. No charge for my assistance. Medicare A and B have no maximum out of pocket for the consumer, which means if all you have is A and B, a serious illness or injury could bankrupt you. To avoid this, you either need a Medicare supplement and a drug plan, or a Medicare Advantage, which is Part C, to limit your out of pocket. Medicare supplements, they work with Medicare. What happens is you go into the hospital, Medicare pays part of the bill, Medicare supplement pays part of the bill, and you may pay part of the bill. If you want prescription drug coverage, you've got to have other coverage like the VA, retiree coverage, etc. If you don't have such coverage, you'll need to get a separate Part D plan. These generally cost more per month than the Medicare Advantage plans. Primary advantage to Medicare supplements is there's no networks. You simply ask the doctor, do you take Medicare? If they say yes, you are covered. The other advantage is generally a low out of pocket. There's a few exceptions to that, but I'm not going to get into that. So if you have one of these Medicare supplements, you'll not be getting the correspondence I'm going to be talking about a little later. Okay, Medicare Advantage works differently from a Medicare supplement. It takes the place of Medicare. Here, Part A and B premiums are still due. Say, for instance, Medicare approves John Doe for the XYZ Medicare Advantage plan. John Doe and XYZ are responsible for paying for all the Medicare approved services. In exchange for XYZ and John taking all the risks for John's medical needs, Medicare sends a check to XYZ every month while John is their responsibility. As such, if John has a medical problem, Medicare will not pay for any of his needs while he's covered by XYZ. Now, here are the advantages to getting a Medicare Advantage plan. Lower premiums, and there are maximum out-of-pocket limits, which drove us to this fork in the road. And in most cases, they include Part D. The disadvantages, more out-of-pocket most of the time than Medicare supplements. And you've got to confirm that your doctors are in network, or you may be paying more for their services. Okay, now the letters I've been talking about that people will be getting right around this time of year, which is late September, early October. Every year, if you're on a Medicare Advantage plan, you will likely get an annual notice of change letter. I'm going to call that an ANOC from now on. It's a notification of the changes of the plan you are in. If you don't desire to change anything, you can simply do nothing and you'll roll into the new plan on January 1. However, suppose you want to change plans. So if you want to change plans, you have to fill out an application between October 15th and December 7th. You can change your mind as many times as you like during that. The last application received on or before December 7th will take priority. Okay, agents can begin talking about these plans beginning October 1, but are forbidden from taking applications prior to October 15th. Some people will not get the ANOC letters. They will get termination letters. More on that. So be watching your mail. If you're on a Medicare Advantage plan, you're going to get one of these two letters. Termination letters. If you don't get an ANOC letter, and it's not because the post office didn't get it to you, you'll get a termination letter indicating that your plan will be leaving the area at the end of the year. Like those who get the ANOC letters, you can begin submitting applications on October 15th for coverage beginning January 1st. Unlike the people getting the ANOC letters, you will have an additional special enrollment period from December 8th to December 31st. So basically, from the 15th to the 31st, you have your opportunity to change to a new plan. Caution, if you get a termination letter and do nothing, you'll find yourself on A and B all by itself January 1. Why is this happening? I mean, it happens from time to time, but this year it's especially prevalent. Before the passage of the Inflation Reduction Act of 2022, when purchasing Part D drugs, that's part of Medicare Advantage usually, there was no maximum out-of-pocket for consumers when purchasing prescriptions. So when the catastrophic coverage level was reached, most clients in this situation would be paying 5% of the cost of the more expensive drugs. And there was no point where they stopped paying out of pocket for a portion of them. After the act passed, there was now a maximum out of pocket for the consumer for Part D drugs and limits on insulin. For 2025, the current max out of pocket is $2,000, meaning once you get to $2,000 out of pocket for prescription drugs, this doesn't count your doctor bills and your hospital bills, you stop paying for prescriptions for the rest of the year. Now, keep in mind the earlier slide, we indicated the various Medicare Advantage companies are getting paid a monthly fee for taking care of John Doe. Before the Inflation Reduction Act of 2022, they were not responsible for as much of the drug cost as they are now. Now they have less money to pay for doctors because they're using more of the Medicare dollars for drugs. And the Medicare Advantage companies have to stay in the black. They have to make more than they pay out. As such, when they're negotiating with doctors and hospitals, fewer doctors and hospitals are accepting what the Medicare Advantage companies are able to pay. So where a licensed agent like me can help. Number one, there's no charge for the consultation. This is the law. And independent agents can select from a number of companies. They can help you understand how your plan works. Matter of fact, they're required to help you understand it. They can help you check to see if your prescriptions are in formulary. They can help you check to see if your doctors are in network. So, important questions for each stage of life. Once you graduate, be it from welding school, engineering school, or law school, you're going to need a different plan tailored to each of these stages for your individual situation. During your working years, your primary thing is, am I saving enough and is it in the right place? Glide path to retirement, which I define as the last 10 years prior to retirement. Will the USS retirement be shipshape on the appointed day? Retirement. How do I avoid running out of money before I run out of life? Legacy. Does what I worked hard for get to where I wanted it to after I'm done with retirement? You can reach me at herwirefinancial.com. I do in-person, Zoom, and phone appointments. I am licensed and registered across several states and can easily add states if there's a need. If you'd like to schedule an appointment, click on that Schedule an Appointment button in the upper right-hand corner of my website. Want to see more videos like this? Go to my website and click on the YouTube channel. It's that red button 2 over from the Schedule an Appointment button. Please like and subscribe. If your friends want more information, they can follow me on Facebook, LinkedIn, or Twitter. For those who prefer the good old-fashioned telephone, my telephone number is 518-631-2569. Do not text that number. We'll both be sad because I won't get it. There's a separate texting number. Opinions voiced in this material are for general information only, not intended to provide specific advice or recommendations for any individual.